Hello, this is Orjanette Bryant with Natural Nubian, and today I'm with my special guest, Dr. Gwendolyn Grant. This is wonderful.
Delighted.
Yeah, wow.
Now about women.
Yes.
And menopause.
Mm-hmm.
The subject most women don't like, and I keep telling you, menopause means power.
Power.
What kind of power?
Well, you got to explain this to me because, first of all, tell me, what is menopause?
Menopause comes in 5 stages. 5 stages.
Okay.
And the process goes on. I'll tell you after we get to that. First, the stage is premenstrual.
Okay.
Premenstrual.
I need to take notes.
Premenstrual.
Is that okay?
Yeah, premenstrual. And then there's the onset of menstruation, which is called the menarche. menarch, the menarche. When I was a little girl, my mother had a dinner party for me when I got my period.
Oh.
It's in my book, The Best Kind of
Yes.
Life. I wrote about that. My mother had a dinner party, my grandfather was there, my mother was there, my father, my sister, and I made a speech about what it needs. And I said, this is very important that we celebrate these stages of a girl's life, and boys too, and that we don't hide it.
Okay.
My father knew I had my period. We didn't hide the fact that I used sanitary napkins because it's all normal.
It is. How did you learn that? Because for me, I don't know. My family never talked about.
Well, I had a different kind of mother. Ethel was from Woodstock, Alabama, but she went to Tuskegee in 1928. Dr. George Washington Carver, the great black scientist, was my mother's professor. So a lot of what you hear coming out of my mouth comes straight from Dr. George Washington Carver. They both had asthma. My mother had asthma. He gave her remedies for her asthma. So I thought he was part of the family when I was growing up.
Okay.
So I have this psychology from my mother. I always knew where babies came from. She'd tell me, watch the dog, have the puppy. The only thing we don't do, we don't chew the umbilical cord like the dog. She's teaching me in age-appropriate language. Not something dark and dirty. My tall, handsome father was always kissing on my mother and feeling her in front of me. I thought that's what...
So your mother was an educated woman, so she shared that knowledge with you.
Me. Yeah. So the onset of menstruation is the menarche, right?
Okay.
So I got my period now. I'm celebrating. Then menstruation itself. That's number 2, and then number 3 is perimenopause.
Okay.
Perimenopause is just before you go into menopause. That's between the age of about 35. It starts from about 35 to about 50.
35 to 50.
Okay.
Now,
for some women, menopause can be from 45 to 55.
Okay.
That was my marker, 45 to 50. By the time I was 56, it was over.
Okay.
So that's stage number 4. Stage number 5, postmenopause.
Okay.
I'm postmenopausal, doing well, thank you very much. And one of the things I like about this is that, hot flashes and all of the things that you have, I never had that. I had night sweat. You throw the cover off, My girlfriend would break out in this, this perspiration. We were having lunch. We're all different. Some people use what I call chemicals like estrogen and whatnot. Others don't. They use herbal.
Yes.
It's up to you and your doctor and what he suggests to you.
Okay.
But some
Did you try any herbals like the black cohosh and all those different things?
No,
that
I just
use?
changed my diet. I paid attention to my diet.
Oh.
My husband's a vegetarian.
Okay.
So I started eating like vegetarian.
Okay.
And that helped me a lot. So I didn't have, as a matter of fact, I went through menopause very smoothly, And my mother told me about menopause. That's my recommendation to everybody.
Diet.
Talk to your young daughters about menopause. Don't hide it.
Okay.
And pay attention to your diet, what you're eating. Ask your nutritionist what will be helpful. Go into the herbal thing, but if you need a physician, also consult your physician. So it's very important that women consult their physicians about everything about your body, because the female body is so interesting and so complex.
Yes. I mean, the body, it does,
I think
like she said, it's amazing.
It's amazing.
I mean, we all do different things at different stages of life, and for me, I actually kind of thought I was going, but you're right, I'm premenopause. I'm not quite in menopause because I do the sweats at night, have my hormone levels checked, and they say, "Oh no, you're fine."
And we get emotional too. We get emotional.
What's the emotions? Can we get rid of that or what?
No, because the chemicals in the body, progesterone and estrogen, are calming down, blah blah blah, and you're out of balance.
I am.
Yeah, your chemicals are out of balance, but you don't have to pay what I call. I don't have to focus on that. You know, you don't have to be the big B in town because you're having menopause.
Right, please go talk to your doctor. What do you have to say about all of that?
Oh no. See, we want a pill for everything.
We do.
This is a drug country.
Give me an instant something.
Yeah. It's like fast food, fast drugs. And we need to get out of that psychology. Where is your common sense? Where is your discussing this issue with your physician? Please discuss it with a physician that you trust.
Right. We have to be sensitive to cultures. And even when we're talking about this menopause thing, you know, a lot of times, you know, the African American culture have their own theories when it comes to healthcare and menopause and different disease process. Like I said, it's taboo actually for a antidepressant in the black culture in some cultures. However, my mother was a psychology major, so you know, of course, pill popping was something she studied. So she's like, you know, she says you don't need it permanently, but you can take a little bit for a little while just to get you balanced. But then again, you went back to let's get to the root cause. It's the hormone imbalance. It's the off levels. And once you get to a certain level where you're starting to get yourself back to balance, it comes together nicely.
I suggest support groups for women, by the way. So women who are menopausal get together and start talking about these issues, share your experiences, and you will empower one another. Dr. Alan Sosberg, who's the head of psychiatry at Stanford University, has done a study. And he said, he started his lecture out with this is how he started. The best thing a man can do for his health is to be married to a woman. And the best thing a woman can do for her health is to connect with her girlfriends. Because he says men discuss activities and women discuss their emotions. Therefore, when we get together, we empower one another, we help one another, we lift one another. He said, actually, getting together with your sisters to talk about any issue, menopause or any other, is good for your health, Dr. Alan Sosberg says. And he ended his study by saying, it actually increases longevity. You live longer with these connections to your sisters. I love that study. You should look it up on the computer. Dr. Alan Sosberg, head of psychiatry, Stanford University.
I think that's, I can identify with that. I have a lot of girlfriends. I mean, I go to them, prayer partners, different things.
That's right.
And
prayer partners.
And I try to keep it away from husband because, you know, we're so emotional. It just doesn't make sense. He's like,
excuse me, but sometimes I get on my husband's last nerve. Okay?
We do, don't we?
Because I'm talking all this emotional stuff. See, they want to problem solve. Let me tell you about men. I've been married to men long. We want to talk about the problem. They want to solve the problem.
They want to solve it. That's true.
And we just want to talk. Because talk, ladies and gentlemen, is very therapeutic.
It is therapeutic.
That is what therapy is all about. It's not that you're going to solve the problem. What you're going to do by talking about, you take control of the problem.
Get it out of the system. Let me just regurgitate. Let me talk about it.
That's right. Either you take control of your circumstances, or your circumstances will take control of you.
That's true. That's very true.